So previously we looked at the superficial structures of the head. Now we're going to look at the deep structures. Okay, once again looking at the dog, just a little review of the vasculature. You see the common carotid artery coming up, giving off the internal carotid artery and the external carotid artery. First branch is the occipital artery coming off here. We see the lingual artery coming down, running with the hypoglossal nerve. Do you remember that? Then we have the facial artery way up here. And then the termination of the external carotid is the superficial temporal artery and the maxillary artery. So now looking at the horse, here we have the internal carotid artery and the occipital artery coming off very close together, the internal carotid coming off first. External carotid artery continuing here. We're going to see that instead of a separate lingual and a separate facial artery, we're going to have a lingual facial artery, and that's going to be running with the hypoglossal nerve. Okay, here we have the mesenteric artery going into the masseter muscle. Caudal auricular artery going to the ear. Then here we can see the maxillary artery coursing deep and the superficial temporal coming off here. And superficial temporal is going to give off the transverse facial artery. In the bovine, what we're going to see, here's the common carotid coming along. Here we have the occipital artery. We may have just a remnant of the internal carotid. Remember that extracranial part of the internal carotid is patent in the fetus and in calves, but usually becomes just a connective tissue strand in the adult. The carotid sinus, therefore, is located in the origin of the occipital artery, since that remains patent through the life of the animal. Here we see the external carotid coming up here. Coming off of that is the lingual facial artery, just as it did in the horse. We have the mesenteric artery going into the masseter muscle. We can see here the maxillary artery and the superficial temporal. And just as in the horse, the transverse facial comes off that superficial temporal. Okay, looking at some deep structures in the horse here, we've removed a big portion of the masseter muscle. We can see the facial vein coming up here, and then we're going to see that it's going to join with a deep facial vein, which is going to run just ventral to the facial crest. And then we have the buccal vein running deep here. Sometimes that deep facial vein is used to draw blood in the horse. Generally that's in a situation where the animal must be restrained with a twitch and you're unable to reach the jugular vein, and therefore you just palpate that facial crest and drop that needle in deep ventral to that to find the vein. Not something you want to do if you don't have to. Okay, here we've got the sagittal section through the head. See the dorsal nasal turbinate here. Ventral nasal turbinate here. Ethmoid turbinates back here. It's a little bit more open to see the nasal meatuses. We're going to have the dorsal nasal meatus, middle nasal meatus, and ventral nasal meatus, just as we did in the adult. And remember, between the turbinates and the nasal septum is the common nasal meatus. And if we're going to pass a nasogastric tube, we're going to pass it at the junction of the ventral nasal meatus with that common nasal meatus. And that will take us right into our nasal pharynx. Here we can see the soft palate here, and the larynx back here. And here we see the guttural pouch. The guttural pouch generally has a median membrane that basically separates the two pouches. So you may see that on one side of the head. Okay, so here's another good view. Here we have the soft palate with the nasal pharynx above and the oral pharynx below, caudal to that palatoglossal arch. Here's our palatopharyngeal arch, which separates our nasopharynx from our laryngeal pharynx. Not labeled here, but very obvious. We can see the medial retropharyngeal lymph nodes right here. Now if we look a little closer at the upper left-hand corner of this, we can see the longus capitis muscle attaching here at the junction of the basi-occipital bone and the basi-sphenoid bone. Remember, in young horses, before these basal bones of the skull have fused, we can get a fracture of these bones when the horse is rearing up and pulling back, and then either hits the pole of the head on an object such as the ceiling of a trailer as it's trying to back out of a trailer, or it may fall back and hit the ground with that, and this is very unfortunate and often fatal. Okay, if we are to take a section but like this dotted line here through this region, we'll see something similar to what we're seeing here on the illustration on our left. We can see here the lingual tonsils in the base of the tongue. That one to the lateral edges of the oral pharynx, caudal to the palatoglossal arch. We're going to see these roughened elevations, which are the palatine tonsils. Nothing like what we saw in the dog. We're going to have tonsils of the soft palate within the soft palate on that more ventral surface. And then in the dorsal caudal part of the nasal pharynx, we're going to see the pharyngeal tonsils. These pharyngeal tonsils generally regress with age. Okay, similarly in the bovine, we take a section right there, we would see the lingual tonsils once again. We're going to find that the palatine tonsils are found surrounding the tonsillar sinus. See a little opening there that goes into the tonsillar sinus. Now in this image here, we can see the tonsillar sinus coming up in like this, going back out, and around that we have the palatine tonsil tissue all right up around like this. Tonsils of the soft palate once again, and also pharyngeal tonsils. Okay, also you can see very nicely here the medial retropharyngeal lymph nodes. Okay, here now we're looking at the equine. The piriform recess is that region around the larynx in the laryngeal pharynx. Here we see the hyoepiglotticus muscle, which acts to depress the epiglottis. It's attaching to the basihyoid bone right there. Now I've highlighted the epiglottic cartilage. Here's the thyroid cartilage. The thyroid cartilage has a very large ventral notch, thyroid notch caudally, so we don't see as far caudally that it goes back in this image here. Now, ossification of the thyroid cartilage is not uncommon in older animals, so that you can see it in a radiograph as we see here. So there's the thyroid notch. Here would be where the arytenoid cartilages are. And then here's the cricoid cartilage. We see, remember, both dorsally and ventrally. And there's the laryngeal ventricle. The aryepiglottic fold. That is the vestibule entering in. The rima glottis is that area around the vocal fold. And then caudal here is the infraglottic cavity. Okay, now in this image here, what we have is up in the left-hand corner a section that was cut just off midline, and then down in the lower right is a more of a dorsal view upon the larynx. And so we look here and we can see the thyroid cartilage, the arytenoid cartilage, the cricoid cartilage, and then here on the dorsal surface of the cricoid cartilage going to the arytenoid cartilage is the cricoarytenoideus dorsalis. Remember, its function is going to be to abduct the vocal folds or open up the airway. This is the one that in roaring we see clinically because the inability to open up that airway, the vocal fold flaps in the air and causes a roaring sound when they inspire. Okay, now here we see the cricoarytenoideus lateralis. And over here we see the thyroarytenoideus. The thyroarytenoideus is seen also on this image here, where we can see both the vocalis portion, which is in the vocal fold, and the ventricularis portion, which is rostral to this opening right here, which is the laryngeal ventricle. Okay, we can't forget down on the ventral surface of the cricoid cartilage, and also we see it attached on the inner surface of the thyroid cartilage right here is the cricothyroideus muscle. So the cricoarytenoideus lateralis is important for closing the vocal folds. The thyroarytenoideus, remember, is going to pull the arytenoid ventrally so that the vocal fold loosens and it lowers the pitch, whereas the cricothyroideus is going to tense the vocal fold and raise the pitch. Now looking at the bovine, once again hyoepiglotticus muscle, basiohyoid bone, there's the epiglottic cartilage, the thyroid cartilage, the arytenoid cartilages, and the cricoid cartilage. Here we can see real nicely the aryepiglottic fold in this image. And notice there is no laryngeal ventricle in the bovine. Here we see the cricopharyngeus muscle coming off the cricoid cartilage, going into the wall of the laryngeal pharynx. The thyropharyngeus muscle coming off the thyroid cartilage, doing the same. Our sternothyroideus muscle coming into that thyroid cartilage from the sternum. Then going from the thyroid cartilage to the hyoid bones is the thyrohyoideus. So we've got this nice little trio right here attaching to the thyroid cartilage. Hyopharyngeus is going to be coming off the hyoid bones and also blending into the pharynx. And so the reason I point these out is because between that hyopharyngeus and the thyropharyngeus, we find the cranial laryngeal nerve. So just as I said, it passes between the thyro and the hyopharyngeus muscle. And what is this going to innervate? Okay, remember it innervates just one of the laryngeal muscles, which is the cricothyroideus muscle. And it's also going to be sensory from the laryngeal mucosa. Right, there's that cricothyroideus muscle. Okay, also we can see in this image is the caudal laryngeal nerve.
I identified this as it passes between the dorsal edge of the thyroid cartilage and the cricoarytenoideus dorsalis muscle. And what is this innervating? That's right, this is innervating all of the other intrinsic laryngeal muscles. Okay, so here, see the soft palate. We see the epiglottis resting on that soft palate. This is more constant than what we see in the dog, although this does occur in the dog. With a horse, we do not see them breathe through the mouth. Here we have, in the nasal pharynx, the opening into the auditory tube. Remember that the guttural pouch is kind of a outpocketing of that auditory tube. Got another view of the guttural pouch here. We can see the stylohyoid bone is going to divide it into a medial and lateral compartment. We see multiple cranial nerves that are going to be associated with the wall of the guttural pouch. So there's the vagus nerve, the hypoglossal nerve, the glossopharyngeal nerve, also the internal carotid artery is closely associated with there. Function of the guttural pouch, they have found that the air rushing through that guttural pouch when the horse is running, because of that close association with the internal carotid artery, is going to cool the air going to the brain via that internal carotid artery. Otherwise, when the horse is running, the temperature of the blood would basically fry the brain, and so it's important that that blood is cooled before it gets to the brain. Clinically important is that we get fungal infections in this guttural pouch because it's a moist, warm environment, and those infections generally are more invasive of the wall. We can see cranial nerve damage to 9, 10, 11, or 12. Also damage to the cranial cervical ganglia. Basically, 9, 10, 11, and 12, you're going to see trouble eating and swallowing. But if it's cranial nerve 10 that's effective, then you may also see cardiac signs and GI signs. Okay, here's another view of this area. Here's our external carotid artery, internal carotid, and occipital artery. We'll do a nice little crossing here. Here's a hypoglossal nerve, which is going to be coursing. If we were able to see a little more rostral, we would see the lingual facial artery coursing with that. Here's a glossopharyngeal nerve running more dorsally, but in a very similar pattern. It's going to cross lateral to the cranial cervical ganglia and medial to the external carotid artery, whereas the hypoglossal is going to be coursing lateral to the external carotid artery. There's our vagosympathetic trunk here. And right there's our cranial cervical ganglion. And there's our vagus nerve there. So remember that cranial cervical ganglia is the sympathetic portion coming off the vagosympathetic trunk. Okay, there we also see the accessory nerve. So we see cranial nerves 9, 10, 11, and 12 here, as well as that cranial cervical ganglia and the internal carotid artery being closely associated with that guttural pouch. Okay, if you have internal carotid artery damage, you may have a couple bouts of what's called epistaxis. That's where you get bleeding from the nose. Before you get the complete rupture of the internal carotid artery, then you find the horse laying down with a pool of blood around its head and dead. Not a good thing. Okay, this is an image of the bovine. Here we have the facial nerve coming out with the auriculopalpebral nerve here. Buccal branches of the facial nerve. Here we see the mandibular nerve and the auriculotemporal coming off of that. Remember, that's going to have that branch that joins the dorsal buccal branch of the facial nerve. Inferior alveolar nerve coming off the mandibular nerve as well. The mental nerve here. Here's the maxillary nerve, giving rise to the infraorbital nerve. And then coming out the zygomaticotemporal nerve, which is from the ophthalmic division of the trigeminal, we find the cornual nerve. Cornual nerve, as implies, it's going to go to the horns. It's important to note that the infratrochlear nerve, which is also off the ophthalmic division of 5, may course from the dorsal margin of the orbit to the horn. It's important to note that sometimes it does innervate a little bit of the horn, so especially when you are dehorning an adult animal, that's important to remember. So here on the bovine skull, we identify the temporal line. Just ventral to that temporal line, we're going to find the cornual nerve as well as the cornual artery. Now, something to remember when you're dehorning a goat, you need to block 2 nerves on each side. One is going to be that zygomaticotemporal nerve. That's generally blocked halfway between the lateral canthus of the eye and the lateral base of the horn. And that's for the cornual nerve. And then that infratrochlear nerve, you want to basically block it halfway between the medial canthus of the eye and the medial base of the horn. Okay, I just want to point out here, right at the initial portion of the horn is where we have the epicaris. This is where the primary horn growth occurs. We need to make sure if we dehorn the adult animal that all of this is removed with dehorning. Okay, here's just an illustration that shows the horn, the corium. Remember that the corium is the same as the dermis, but we use corium for the horn and the hoof and the claw. Cornual process of the frontal bone. And then here we have the cornual diverticulum of the caudal frontal sinus. Looking at the smaller illustration above, we have dermal papilla and germinal epithelium, and so this gives rise to, once again, tubular horn within the horn itself. We notice that in cows we're going to have rings formed in horn growth due to the variation of growth during pregnancy. We will not see this in a bull. Bull, it'll be nice and smooth. Okay, looking at the equine eye, we can see the corpora nigra or iridic granules that are on the dorsal margin of the pupil here, coming off of the iris. So let's follow the journey of a tear. So we have the lacrimal gland here, which is going to have lacrimal ducts, which empty into the lateral dorsal margin of the palpebral sac. They're going to then drain across the eye to the puncta, which are dorsal and ventral to the medial canthus and the caruncle. From there, we're going to have lacrimal canaliculi that are going to lead into the lacrimal sac. Remember that lacrimal sac is going to be sitting in the lacrimal fossa. Okay, we see here in the horse there is an osseous portion of the nasolacrimal duct. On a radiograph we can see that here. Down here what we are seeing is the infraorbital canal. Don't confuse those two. Okay, from the nasolacrimal duct we then emerge here through the orifice of the nasolacrimal canal. Okay, over here we have a nasal diverticulum in the horse, which is going to further slow the airflow through the nostrils. See the flaring of the nostrils as the horse breathes in. That's due to air catching in that nasal diverticulum to slow down its flow through the nasal cavity. And that's all I got for you. Thank you.